Hi, my name is Dr. Kira Gecht, and I'm a dentist from Sarasota, Florida. I have a practice called Simply Smiles, and I get a lot of questions about implants. So let me tell you more about it. I'd love to think of dental implants as artificial roots. We have a tooth, and it's great. But sometimes, for various reasons, the dentists, we always try, we can't save the tooth. So dental implant is an artificial root. That's as close as we can get to replace our natural teeth. There are several conditions when dentists might recommend a dental implant. Sometimes the tooth has been decayed, broken down, diseased so much that unfortunately, despite our best efforts, we just cannot save it. That's always our first choice, but sometimes that cannot be done. Sometimes the support system of the tooth, which is the gum and the bone, is diseased. And once the support system is gone, unfortunately, the tooth that might be in a good condition, that cannot be saved either. So that's the reasons why people lose their teeth, and dental implants could be the answer to replace the natural teeth. There are multiple advantages of dental implants. Number one, it's amazing technology. Before, people had no choice but to get false teeth, such as dentures. Now we can help them feel good, look good, eat well, smile well, do all the things that they can do with their natural teeth using dental implants. Some other advantages of dental implants that it also helps us save the teeth on, let's say, either side of missing space. Sometimes you have, two teeth and there's a missing tooth. And so the best way is to replace it with another tooth, like replacement. And the best thing we can do is to use dental implants, which also helps us keep the adjacent teeth from shifting around and being lost. So there are several steps to see if my patients are qualified for dental implants. Usually I go through three things. Number one, we gotta have a healthy patient, because it's hard to place an artificial anything, just like, artificial knee. Number two, we gotta make sure the patient has enough bone, because that's what supports the implants. And the third thing is really the budget. I hate to bring it up, but dental implants can be expensive, but they're a great replacement for missing teeth. So when I or my colleagues place dental implants, there are multiple steps. The first step is to determine whether or not there is enough room to place the implant. Just like you gotta have a foundation. You can't just build a house on the sand. So you gotta make sure that there's enough support, such as bone in the gums. So first we determine that. And we have multiple things that help us to gauge that. We do a full exam. We do a intraoral scan. I also have a CT scan that shows me in great detail the amount of bone that we have. So that's very important. Planning is number one thing. Once we determine that we have a good foundation, that the placement of the implants is actually the easy part, because it's all about the planning. All I gotta do, and sometimes we don't even have to do any cutting, is to create the space, make literally an opening in the bone, and then we'll just drop the implant in, and then we wait, because you gotta wait for the implant to integrate, to become whole with the bone. Great, now we have a foundation. Great, we have a foundation. How about the house? So after the foundation is solid, then we usually use a scanning ability to scan, and then we basically take measurements, and then we get the tooth or teeth in your mouth. Because you really, patients don't truly appreciate the foundation. The nerds like me do, because that's what we do. But it's about getting your ability to eat, getting your ability to smile, getting your ability to be comfortable with yourself. That's what really matters to you, my patients. Oftentimes, when the foundation, such as the bone, is not enough to place the implant, we need to reinforce it. Listen, you take out the tree, there's going to be a sinkhole. And if we don't fill this in, that's what we call a bone graft, then the ground is going to recess, and it's going to be hard to replant the tree. So we're going to do a bone graft to get us the right foundation, and then it's easy just to drop in an implant. I have a patient who doesn't have any teeth. There are multiple options of how we're going to replace them. Sometimes we're able to have replace their teeth so they are staying in the mouth, they screwed in or cemented in, and that's definitely what I would strive for. But sometimes we are able to only do dentures. There's multiple reasons why we can do one versus the other. The main thing is how long has the patient has been missing their teeth. The longer they're missing the teeth, the less of a bone support we have. Just like with our muscle. Listen, I work out, so guess what? My muscles are nice and strong. And when I stop, they're gonna start dwindling away, okay? So that's what happens to the bone. Once we don't work out, I'm sorry, there's no teeth in there, we lose the bone, and there might be the only option we might have is to have an implant-supported denture. And for some patients, that might be the best solution because it's easier to maintain, easier to clean. Some people with manual dexterities, there could be one option better than the other. And for that, you really need to come in and let me tell you what the best option would be for you. The recovery after placement of the implant rather different. Sometimes there could be no downtime at all. If my patient has just one single missing tooth, oftentimes I call them, they write back to their normal activities within a day or two. And sometimes when the procedure is a lot more extensive, that might take a few days to a week. But no worries, I have a great protocol where we can manage patient comfort very easily. I get to ask this the question of how long the dental implant lasts very, very often. They do last a long time, but like anything else, if you want it to last, take care of it. Dental implants, fortunately, cannot get cavities because, again, titanium does not decay like natural tooth. Simply Smiles offers different options when it comes to make this treatment more affordable, making dental implants more affordable. We have financing options. We have multiple things that can be done to make it easier for our patients. And please give us a call. Come in, get a consultation, and find out if the dental implants are right for you. And also, we can tell you more in person about the financing options we have. I have a lot of patients who have dental insurances, and I always get the question if dental insurance helps with the cost of the implants. And the answer is, I'll be honest with you, I don't know. There are as many dental plans as there are people, and it's all about the fine print. But guess what? You deserve the best despite what insurance does or does not cover. I am not gonna focus on that. I'm gonna focus on your health and what you need. Thank you very much. I appreciate you guys are interested in dental implants, and I hope I answered some of your questions. And I'm sure now you have probably even more questions. So please give my office a call. My office, Simply Smiles. I'm Dr. Gecht, and my phone number is 941-921-4654, and I see you soon.